gland is a part of the endocrine system of the body, which is the hormonal system. It is responsible for maintaining the basic metabolic rate, which is the rate at which the body functions on a day-to-day basis. It produces a hormone called thyroxine in the form of T3 and T4, which acts on different systems of the body. Systems such as the nervous system, the GI or the gastrointestinal system, the heart. The menstrual cycles are regulated by these hormones, and also it can control the fertility in a lifespan of a female or male. Thyroid disorders could be asymptomatic. So a patient walks into the clinic, absolutely fine, we do a blood test and we see that they have a thyroid abnormality. Rest of the patients can present with several symptoms such as that of mood swings, irritability, hyperactivity of the bowel, perhaps sometimes constipation, problems with fertility, menstrual irregularities, muscle aches, bony pains, etc. What are the diseases that a patient with thyroid disorder can have? It could be hypothyroidism, hyperthyroidism, goiter, pregnancy-related thyroid disorders, thyroid disorders seen in newborn children called congenital hypothyroidism. Last but not the least, cancers of the thyroid which can present as lumps and bumps in the thyroid gland. Now, what are the causes of thyroid disorders? It could be most commonly autoimmune in nature, where our body's own immune system fights against the thyroid cells. Alternatively, it could be certain medications, post-surgical removal of thyroid, newborn disorders of thyroid, and genetic association where the thyroid disorders can run in the family.
Thyroid diseases are classified as hypothyroidism and hyperthyroidism. Now, hypothyroidism is a condition where the thyroid does not produce enough of thyroxine. Now, in this situation, the balance of chemical reactions in the body gets affected. Now, there are various causes for hypothyroidism. Some of the most important causes are the first one being autoimmune, which is called Hashimoto's thyroiditis. Secondly, the treatment of hyperthyroidism. Thirdly, radiation therapy. Fourth, following any surgery which involves the head and neck. And lastly, certain medications. The next most important disease of the thyroid is the hyperthyroidism. Hyperthyroidism is where thyroxine is produced more or in excess by the thyroid gland. The most important cause for hyperthyroidism is Graves' disease. Graves' disease is again autoimmune, wherein the body's immune system produces antibodies which stimulate the thyroid gland to produce more thyroxine. The next most important cause for hyperthyroidism is toxic adenomas or toxic multinodular goiter. Here, these toxic adenomas, they are non-cancerous benign lumps which are found in the thyroid gland, and they are walled off from the rest of the thyroid tissue, and they start producing excess of thyroxine. So how can we treat hypothyroidism and its symptoms? It's extremely simple. By supplementing thyroxine in the form of tablets. Also avoid eating large amounts of cabbage, cauliflower or broccoli. Similarly, the treatment of hyperthyroidism involves a prescription of antithyroid drugs. So this summarizes the treatment of hypothyroidism and hyperthyroidism medically.
Usually, the ultrasound will detect whether the right lobe or the left lobe is enlarged, whether there are multiple nodules, whether the gland is having any solid or a cystic change, whether there are lymph nodes around in the neck. If any of these features are detected in the scanning, then we go ahead for the next test, what is called as the fine needle aspiration cytology, wherein with the help of our radiologist, an ultrasound guided needle test is performed. The name of the surgery is called as thyroidectomy, and here we can remove either one side of the lobe along with the isthmus, which we call as hemithyroidectomy, or we remove both the lobes and the isthmus, called as the total thyroidectomy.
The main indication of surgery in thyroid disease is, one thing is carcinoma and another one is toxic nodular goiter. And after once the FNAC shows that it's a carcinoma or suspicious of carcinoma, we have to subject the patient for the surgery. One take-home message for the patient is there is nothing to get afraid about the cancer, because thyroid cancer is totally curable. once it is diagnosed in an early stage.
We at Universal Hospital have a fully equipped team of surgeons, anesthetists, intensivists and radiologists.
Physician, endocrinologist and pathologist,
So together as a team, we will take care of the patient
so that we can give you a complete care in one setup.
and they will be in safe hands.
It gives us immense pleasure to share with you all that we at Universal Hospital are launching a thyroid clinic, operational on Sundays and Wednesdays between 9 a.m. and 9 p.m. We are available at Wellness Tower 2 on 4th floor, where a team of our medical and surgical specialists will help you screen and treat your thyroid disorder. Come and join us in overcoming thyroid disorders.
Thyroid problems? Worry no more. Overcome thyroid disorders at Universal Hospital. Visit our Thyroid Clinic on Wednesdays and Sundays at Wellness Tower 2, 4th floor from 9 a.m. to 9